Hello everyone. With the news that Operation Magenta have recently identified 3 suspects under health and safety offences, I thought it prudent to acknowledge that this is not the first time that the families have questioned why the HSE has yet to be involved in the mass deaths that existed at Gosport War Memorial Hospital. In 1988, when Dr. Jane Barton joined the hospital, the nursing staff actually, over a period of 3 years, there were a couple of whistleblowers that came forward and wanted to question the use of syringe drivers that Dr. Jane Barton had implemented at the hospital, which meant that they were being asked to put patients who were not in pain and clearly nowhere near end of life on a syringe driver with high doses of diamorphine and in some cases midazolam, and then finding their patients in the morning comatose and dying. And they raised their concerns, and they were those concerns were squashed, and they were essentially left with some minutes, which we now know and identify as the 1991 document, which outlined those concerns, and also that they should continue under the protocol of Dr. Jane Barton and continue in those methods which they were saying was ending life unnecessarily at the hospital. And then we sort of fast forward a little bit to 1998, when the first version of the Health and Safety Act or protocol was agreed, and that was agreed by the police and the HSE and the CPS, and shortly after revised to include local government associations and British Transport Police and so forth. And really it was there to emphasise, as I read and understand, the collaboration and importance for all of these bodies to come together when there has been a number of deaths under a particular corporate umbrella, and to ensure that everything is investigated thoroughly, and ultimately to ensure that there is an appropriate prosecution of the individuals who have, committed these health and safety offences. And, right back to early 2000, my mother, Anne Reeves, who, most of you will know, was questioning directly the police officers who were leading Operation Rochester at the time, as to why they hadn't actually called in the health and safety executive, not knowing, of course, that the protocol existed, and that that was a signed document that in fact they should have been adhering to. But we were told right back then that that the HSE shouldn't be involved, and the police had no requirement to get the HSE involved, even though Detective Inspector Nigel Niven, Chris Yates, who were intrinsic in the Operation Rochester investigation, were actually also, which we know today, also in the background actually forming part of the methodology for the protocol itself. So it is highly questionable why the HSE were not called in those early police investigations in the first place, especially as we saw it that this was a case for mass murder and corporate manslaughter at the very, very least. So that was probably our first questioning of why was the HSE not brought in at that time. And then fast forward again to the formation of the non-statutory independent panel headed by Bishop Jones, who, again, with all of the expertise that is picked in that panel, one has to question why an HSE representative wasn't chosen. Why, through the course of the panel's investigation, they didn't engage with HSE. They didn't have an HSE expert on the panel. This was something that when they published the report, Kate Blackwell, who was the QC, told me directly in my surgery session with her that this will now go down the HSE route. So my question was, with all of the evidence that is now published in the report and the evidence that is not published in the report, because we didn't get a public inquiry. So without the public inquiry, the DH, no matter what, what we know is there is heavy evidence omitted in the panel's report, which I believe is because, all of these sort of non-statutory investigations do have some form of manipulation by government, and in our instance, most likely the DH, who own the report, own the archives, etc. Why this, or how quickly is this now going to be going into a criminal court, so that the appropriate people will be questioned? So the answer to that question from Kate Blackwell QC was that it would be unlikely, and that this would perform an HSE investigation. So this is where we are now. So it's taken Operation Magenta somewhere near 5 years to identify HSE suspects that the families identified in early 2000, and we haven't even got to the roots, or got to the prosecutions that the family, are looking for. What really needs here? So the deep offences that existed. So we were talking about gross negligence, manslaughter, corporate manslaughter, and in the cases where there is clear intent written in the medical file, without hearsay, that those cases are considered for murder. But I think what was important for me today is to really acknowledge that the DOH have known that this is an HSE problem from day one, and they have allowed the families to continue on this battle and fight for justice and transparency and for closure. And that Operation Magenta have taken 5 years to identify this themselves, and that Bishop Jones, himself would have seen these HSE offences right from the start of opening up his investigation, yet never called for an HSE expert onto the panel. So I think it's just very important that we acknowledge this latest news, and just how long the families have been waiting for this to be, at the most basic level, something that has been acknowledged as a health and safety offence in the manner that it is gross negligence, manslaughter, corporate manslaughter. So thank you very much for listening today, and and your continued support and interest into the battle that is victims of gospel. Thank you very much.